My name is Delia Carias. I work at Jude Children's Research Hospital in Memphis, Tennessee, and I am the Medication Use Policy Coordinating Pharmacist there. So I actually did my undergrad at the University of Alabama at Birmingham, and it's in music. But during my schooling, I had to get a job, and I got a job as a pharmacy technician. I did this primarily because both my parents were pharmacists. Now, I had grown up saying that I would never, ever be a pharmacist. So I got this job because I knew it paid well, and I fell in love with pharmacy. It was in my blood, I say. I can't fight it. So anyway, so I finished my undergrad degree, and then I went to Stanford University for 4 years for pharmacy school. Upon graduating there, I did my PGY1 pharmacy practice residency at the Johns Hopkins Hospital in Baltimore, Maryland, and then moved down to Memphis, Tennessee to do a second year healthcare administration residency at Methodist University Hospital. And then after that, I got a job at St. Jude, just down the street from Methodist. I've been there ever since. So my parents really inspired me to go into pharmacy. Although I say I fought it, once I realized that I loved it, I jumped in with both feet. My father was a community pharmacist and my mother worked in a hospital setting, so I got to see both sides, and it became very evident that the hospital pharmacy side was the path that I wanted to take. So my typical day is, there are no typical days. I actually like to say that I practice indirect patient care, so I am not actually on the front lines with the physicians and nurses and patients. I practice in policy and drug information, so I get to develop the policies that say how we're going to treat patients, the therapeutic guidelines that really look at the best evidence and say this is how it applies to our patient population. And so I really see that as affecting patient care on a broader level. So a day could be, obviously I have meetings, often with other pharmacy leaders, other hospital leaders, the chief nursing officer, the chief medical officer, other direct patient care providers, and we together can be working on a policy, we can be working on a therapeutic guideline. I also help decide what medications we keep stocked in our hospital and how we're going to use them and in what patients, which is really interesting, especially working with pediatric cancer patients, because there's always a new oncology medication and you have to review the literature and see, okay, is this treatment going to work for this patient population? And then you have to keep up with all of the knowledge. So you're always learning, there's always a new problem to solve, and that's what I really enjoy. My favorite part of my job is definitely knowing that I'm making a difference. I may not be there directly beside the patient, but the decisions I make and the projects that I help lead and coordinate really impact more than just one patient. I've been involved in several projects that have been recognized over the years as really making clinical differences at our hospital, and that really gives me great joy to know that something that I've done, that I've been able to help with, is making the lives of my patients better. The best advice I could give someone who's thinking about pharmacy is really find yourself a mentor and ask questions and get as much experience as you can. When I was in college, I knew I wanted to be a pharmacist after I made that decision, but I didn't exactly know what place in hospital pharmacy I wanted. So I was able to partner and spend time with a pharmacist in the ICU, spend time with a pharmacist on the cancer unit, spend time with a pharmacist in the dispensing setting, and I really got to see the broad range of practice settings for pharmacists, even within a hospital and health system. So I think that finding a mentor and getting exposure to those will really allow you to find your home and where you feel most comfortable and where you fit in.